So this really relates to the experience and knowledge and understanding of healthcare professionals working within this area. Essentially, we've got some really experienced workers working both in the units and also in the community with many years' experience. We're also seeing that there's it was also talked about that there's been improved collaboration engagement between funders and community-based providers. And so, for instance, one community healthcare professional said, the engagement of our funder with us as suppliers to come up with positive solutions to any challenges has worked well. DHBs are now also engaging with community suppliers and becoming aware that we're long-standing champions of this group of the population. That's the spinal cord injury population. There was a few things that we felt could be improved. We felt that there is room for improvement in the training of emergency department staff. This is commonly talked about, that in acute situations where people with spinal cord injury are needing to access emergency departments, there's a poor understanding of spinal cord injury needs. GPs are seen as being a real key resource for people with spinal cord injury in the community, and they often have really limited knowledge of spinal cord injury specific issues, but the people who formed a collaborative, caring relationship with and trusted relationship with their GP said that they really valued this sort of willingness to work together to find out answers to questions and problems, and that wasn't so lack of spinal cord injury specific knowledge wasn't necessarily seen as a bad thing, as long as the GP was willing to work with the person with spinal cord injury to come up with some solutions. So essentially our recommendations around training and workforce capacity related to more training between healthcare professionals on the continuum. So healthcare professionals working in different settings can have quite opposing perspectives on who's most in need of training. And so we think that collaborative training approaches that recognise each other's skills and where different perspectives can be shared and learnt from would be ideal. So for instance, people working in these specialist units understanding the expertise and the knowledge of healthcare professionals working in the community setting and what are the issues that they're seeing there, and vice versa, so that there's a sharing of ideas across that. We also think there's consideration could be given to telehealth options for joint assessment and planning between healthcare professionals when people across the care continuum are working alongside someone with a spinal cord injury. So those are some of the things we felt would be worth working on in the training and development space.